Hello, everybody.
Yes, I can hear you.
Okay. Shall we start already? It's time to start?
Whenever you are ready.
Oh, I'm ready. I'm ready. I can start my presentation. So we are going to have almost 1 hour to talk about a fabulous device, what I have in my clinic since more than 2 years now. And I want to share with you my experience. It's the Ultraformer 3. What is a HIFU device, and it is used for skin tightening and fat reduction. May I introduce myself? My name is Bettina Rümmeleim. I'm a dermatologist located in Zurich. I'm originally from Hamburg, and I did my residency and my specialty in Hamburg. And then for 10 years, I run my own clinic in the area of Frankfurt. Since 2006, I'm in Switzerland, and for 8 years, I was a head consultant for the Department of Laser Medicine at the University Hospital of Zurich. Since 2016, we run a private laser school, state accredited. We do trainings for medical specialists in the House of Skin and Laser Medicine for all kinds of laser trainings, what you need to be accredited for to perform laser treatments in Switzerland. So the Ultraformer 3 is a very special device, and I'm very happy that we acquired it in the clinic. It is used a lot every day, but I want to share with you how do I decide for a new device, what is always also a financial decision. So I check for these 6 points, what I find very important. Number 1 is the trust in the manufacturing company. Number 2 is the high quality service partner nearby. Number 3, the proven technique. Number 4, the treatment has to be enjoyable for the patient and for the nurse and the doctor. Then the actual market situation in your area and the legal situation. So I want to point out point by point now. So number 1, the trust in the manufacturing company. It is very crucial because when you buy a device of a company that later on gives up or they do not deliver equipment, something breaks with the machine, or maybe the parameters are wrong, you can have a very severe problem, and it might end up that you have to throw your device to the trash, or even worse, you harm your patients and you can end up with difficult problems. So before I start to check the device, I check the company, the background of the company. So the company Classes, I met them first on this Congress in St. Petersburg in 2017, where I heard various talks of very renowned colleagues of mine. So in this case, it was Dr. Klaus Fritz from Germany, and he was presenting about the Ultraformer. And so this built up trust, and I asked him, what do you think about the company? And he said, hey, come and meet them. And this is us in June 2017, enjoying the white nights of St. Petersburg and having deep discussions about the understanding of producing, manufacturing devices, and about the responsibility a company takes on one hand side for the patients, on the other hand side for their customers, what are we, the doctors. So then I did a lot of background check. The company was founded in 2007 and it's present in 55 countries, including Europe, Australia, Brazil, Singapore, Middle East, and Russia, and you find them everywhere. Wherever you travel to congresses, you see Classes is present, and they have very good speakers and they organize very nice symposia. So on AMWC in 2019. I met classes at their booth, what I also find very stylish and nice, the devices and how they present them. They have not uncountable devices, but they work to improve the single device, so they become better and better. Each time when I come, I see something improved, something more elegant, something more practical. And they had inside symposia at this time also. And again, I met very renowned colleagues and had a deep discussion about the cooperation with the company and about their personal experience with the devices. That's me being there with my colleague. So number 2, the high quality service partner nearby. What is also very important, because when you have a problem, you need your service partner to come and to help you out in the moment. So something with the wires, you need supply, you need new applicators, and these needs to be delivered to your place as soon as possible, because a lot of times these problems show up and it's very urgent. So you need to call them and they need to come. And in this case, for me, it's Lasermed here in Switzerland, and I have to say I'm very happy with the cooperation. Check out, this is, in this case, it's a certified company, distributor and service partner in Switzerland. So then, for sure, the technique. How does this device work? So Ultraformer is a HIFU device, and we have to compare. You ask yourself, is it reasonable to have another device in the clinic? Because in my clinic, for instance, we have 35 devices. So we have a whole bunch of devices to run. And I think more than 10 times before I decide if I'm going to acquire a new device, because it has to give me information, or it has to give me a modality to treat skin, to treat my patients that is differing from all the other devices. So compared with radiofrequency and with lasers, let us focus on the comparisons with lasers. Ultraformer is applied directly in the depth without harming at all the surface of the skin. And this is a very big benefit for the customer. So you see that you don't see anything. So patients ask me, how long is the downtime of this treatment, what I want to do? I want to improve the elasticity of my skin. I want to do something to look nicer, to look better. Then they ask me, what is it with a Fraxel treatment? How long do I have to take off from work until I can go back? How long is my social downtime? So with lasers, depending on how strong you dose it, the absolute minimum would be 2.5 to 3 days, but it can be 7 days, it can be even 10 days. With Ultraformer, the downtime is 0. So absolutely no downtime. There might be a little bit of redness, there can be a little bit of swelling. So, but this is a super benefit of the device. And number 2 is the depth. You see, with the Ultraformer 3, we treat in levels. So with the real, I call them the real HIFU hand pieces, it's the 1.5, the 3, and the 4.5 millimeter for the face. You treat in the dermis, you treat in the deep dermis, and you treat directly on the SMAS. So treating sagging, you need a deep treatment. And when you want to treat so deep with a fractionated laser, there will be a long, long downtime. So the application of the energy of the HIFU is with this converter, what is in the handpiece, and you put kind of burning points, this high intensity combusting area as the focus point in the depth, and the handpiece defines where you put this focus point. So it can be, as you see here, 1.5 2, 3, or 4.5 millimeters. That are the handpieces, all handpieces you use in the face. The handpieces mentioned above are the micro-focused handpieces with high energy, so the so-called real HIFU handpieces, while the 2 millimeter depth handpiece is an intermediate between micro and macro focused. It's a 8 times bigger spot with a low density of energy and diffuse heating. The other handpieces, 6, 9, and 13 millimeters depth, are also macro focused, 8 times bigger spot again, with high density of energy, and they lead to a thermal destruction of tissue. It's only suitable for fat tissue due to the less pain sensitivity in fat tissue. So you can use the 6 millimeter, for instance, also for the double chin, while the 9 and 13 millimeters are really only body handpieces. So again, here we visualize the difference between the macro focus and the micro focused handpiece. So the macro focused handpiece is 8 times bigger than the usually in the face use applicators, so-called face cartridges. And with the HIFU, we produce 65 to 75 centigrade degree heat coagulation points without damaging the skin surface. And this is the big benefit compared to lasers, IPL, radiofrequency, and RF needling. So no downtime, no skin damage, and the focus energy is only applied to the target area. So summed up, the most important thing is the downtime point, what is important for the customer. So there can also be spontaneous decisions for this treatment without big arrangements for the private time that you have to take to arrange for seeing people, that nobody should see your treatment. Then the depth of the penetration, the treatment of the SMOS, what is super important for treating sagging. Without the deep penetrations, sagging treatment is not possible. And then another super benefit is the color blindness. So it is suitable for all skin types and all year long. So around possible side effects, with incorrect application, so when you have no skin contact, for sure, the burn point can hit the surface. So you have to concentrate what you're doing and be aware that the handpiece with gel is in good contact with the skin. Otherwise, you will have burns and there are scars on the surface possible, but this is only if you mishandle the handpiece. The penetration chosen too deep can cause mucosa damage. So you can shoot through the skin into the mucosa, and you can even damage teeth, and you can damage nerves. So you have to understand about anatomy. Facial nerves are mostly in 9 millimeter depth, but when you press a handpiece very strong onto the skin, then you will definitely reach the nerves. So you have to understand where are the nerves. You should have a feedback of the patient, so the patient should not be in full anesthesia. So the patient should be able to say, "Ooh, this hurts." So you can move the handpiece to the side out of the pain area. If you shoot on a nerve again and again, you can severely damage a nerve. But if the patient gives feedback, ouch, you can easily adjust the position of the handpiece. So regarding results, it is important that you understand you are not treating the nasolabial fold, you are treating the full cheek because the full cheek is giving the traction on the nasolabial fold. So treating nasolabial fold means to treat the whole cheek. And treating double chin, again, also means that you treat the double chin in different layers. You have to reduce the amount of fat in the depth, but also you have to tighten the skin, both. And you should always include, when you treat the double chin, I recommend highly to treat the neck in addition. So this is possible to have results like this. Unfortunately, not a lot of patients allow to show their photos. You have to make a treatment plan with the patient. The patient is showing up, you take the photos, you explain where you treat for aiming what, and then what we usually do is we recommend the patient 2 to 3 treatments, and we do like the first 2 treatments in a gap of 2 months roundabout, and then a third treatment like 6 months later, when you already see that something is going on and skin is improving and laxity is improving, then the patient is highly motivated to invest in a third treatment. We can use that instead or in combination with Botox treatments of the forehead, because a lot of patients ask, oh, do I have to continue doing my botulinum toxin injections now for the end of my life every 4 months because it lasts so short, or is there anything else I can do to have a longer lasting effect? And then Ultraformer is a very good idea, but you have to be aware on the forehead, the skin is thinner, so you cannot position 4.5, 3, and 1.5 millimeter. It's only the 2 and the 1.5 millimeter handpiece to be used in this area. But you do not have to keep that in mind at the moment, because Classis delivers a very detailed brochure where it's written exactly which program you have to use for what you are aiming for in which area, and where you have to be careful and be attentive to not damage anything. So again, nasolabial wrinkles, this is again a full cheek treatment and not a treatment on the nasolabial folds. In the mouth area, I think this is a bit too positive photo, but I have to say we reach these results, but not with one treatment. For reaching this, we need about 3 treatments, because this is an already older lady with a lot of small wrinkles on the upper lips. And it can be that finally we also add some hyaluronic acid of very light density, and this gives the supernatural result. So the skin is not filled up and blown up, but you see it is really nicely tightened and very well hydrated. A very good indication is also the neck area, where you can have these nice improvements and then maybe follow it up with one injection treatment at the end to even have an even better result. Again, double chin is super beloved treatment. In between there can be some swelling. So you see after the treatment, the skin is red, is swollen, and the patient might not be so happy for some days. But then the collagen remodeling is starting, and you see the nice traction on the cheek, improving the nasolabial fold and a lot of improvement on the neck area. Here, a case of skin rejuvenation. Look on the cheek, a patient that has contraindication for fillers and just wanted to improve the quality of skin. So now this point you might find a bit funny, because when I say it's important that the treatment is enjoyable for the patient and for the nurse and the doctor, I really mean this, because when you run a clinic like me with 35 devices, I'm not using them all myself. I need my staff to do the treatments, and the staff will prefer to do the treatments that they really enjoy. So if a device is very heavy, if it is a very boring treatment, or if it is a very exhausting treatment, that can be that your staff will try to avoid performing this treatment. This is a natural behavior of mankind. So with the Ultraformer, you have an elegant, slim, and easy to move device. So even if the room that you decided to be the Ultraformer room is busy, you can easily just take it out and move it to another room. This is what we do quite frequently. If customers show up and say, hey, today I have time, can I do the Ultraformer treatment, my second one? I enjoyed already the first, I would like us to do a second, and it was not planned in the program. Somebody has time, but the room is not available. So easy to move, and it's an elegant device that even finds attraction. People look at it and say, hey, what is this? You have a new device, looks very, very elegant. What is it doing? What can it do? So then the handpieces. You know, some laser devices have handpieces. They are so difficult to store. You need a new cupboard to place them. You have to invest in furniture to find space for these handpieces. Here you see the handpiece is, you press these two buttons. You see the gray button there in the middle. You press it and just take it off. One click, so easy. And you can store all the handpieces directly in the device. What has, maybe I go one back, you see there is this this part here. Yes, you can open this, and behind there is storage place for the handpieces, for all handpieces you need. So when we say this treatment is not painful, I would say this is a company slide, and I want to say that this is not really true. It's not painful, but it is not so painful that you have to do nerve blocks or that you have to do sedation. Numbing cream does not make sense because as you treat under the skin, the numbing cream is not helping a lot. So what we do is we have just a fan blowing some cool air in the face of the patient, and we give the patient a little bit of pain drops like metamizole 10 minutes before the treatment, so the patient is relaxed enough to perform the treatment without any additional pain treatment. Depending on the severity of the aging process, you speak to your patient and decide with what treatments you want to combine the treatment. So if you have a patient with a severe aging symptoms, you need to do more than just the Ultraformer. But the Ultraformer is a good basis because patients are nowadays very aware of the ugly situation when a face is too much blown up with fillers. So they like to support their natural anti-aging process with the Ultraformer, and then we finish up with some injectables. The injectables can be either to hydrate the surface of the skin. So we would use very light fillers and like a mesotherapy, or we can restore fat departments by doing deep injections on beauty points or empty codes like treatments. So when you assess the patient, you check the medical history, you check the main concern of the patient, you take good photos, and on the photos you tell the patient where you think the treatment should be focused on. You speak about volume loss, you speak about skin laxity, and you basically explain sagging and the big benefit of the Ultraformer to perform a deep treatment down to the SMAS. Here you see the hand pieces. These are the real HIFU hand pieces. And then you see in this table what you do not have to take photos of, because everything comes in the handbook. But you see, you need a lot of shots, and therefore you have to calculate the shots in the price, because these hand pieces are disposables. They use themselves up, and depending on the hand piece, can differ between 20,000 and 30,000 shots per hand piece. So depending on the thickness of the skin and also the underlying structures, you see what I pointed out already before. The upper part of the face can only be treated with the 1.5 and 2 millimeter handpiece, while the lower half of the face can be treated with 4.5, 3, 2, and 1.5 millimeter handpiece. And I do not want to go too much in detail here, but the red marked areas are areas of to be avoided and to be very attentive there. As we know that there can be some variations in the nerve situation, the feedback of the patient, as I told you, when the patient says, "Oops, this hurts," different than it hurt before, you should just slide with the handpiece from this area, lateral or medial, depending on where you are, to avoid a repetitive injury of a nerve, in order not to destroy the nerve. And so I find myself very safe with this treatment, and I feel very comfortable performing the treatment. Ultraformer can be combined with all kinds of treatments you have in your clinic, but for me, Ultraformer is always the basis. The only thing where I might start different, it can be botulinum toxin, because I like to inject botulinum toxin first, to flatten and soften the muscle action, and then have Ultraformer afterwards, but not directly afterwards. So if you inject botulinum toxin in the first appointment, then you would wait some days and have Ultraformer afterwards. With all the other treatments, with fillers, it has to be the filler definitely after you finished the Ultraformer setup. So I would do one Ultraformer, then the second Ultraformer after 1 to 3 months, and then finish up with the filler, and not touch this area before at least 6 months. And with radiofrequency, laser, and lasers, you can even combine that in the same session when you want to treat additionally also the surface. Maybe you want to remove some age spots, or you want to improve some broken vessels, so no problems. When we do the treatment, this would be the situation. You cover the clothes of the patient with a towel, because you use a lot of gel, and then you do not want to mess up the wardrobe. You have your plan, your treatment plan, right next to you, and follow the instruction. And for just to mention this maybe back, for treating a full face, we plan in our clinic 1 hour to have a relaxed situation and not push the patient through the treatment. So regarding market, face treatments, no doubt about, are very requested, and so are body treatments. So I would say, like 4 or 5 years ago, I had really problems to sell body treatments. Meanwhile, patients are very aware of their look, and they ask us, what can I do? My skin of the inner upper arms gets a bit wrinkly. It is not so well hydrated anymore. I do not like to wear short sleeves anymore. Can we do something? Even the inner thighs are very requested. And the global growth market, we think that this will be increased by at least 15% per year. And I can agree, in Switzerland and my clinic, it is definitely like this, maybe even higher. Why is body shaping topical? So for sure, to have a good figure, you need to go for sports and you have to have a good diet. But still, in menopause in particular, the skin quality is decreasing, and with sports alone, you cannot improve the quality of skin and the firmness of the skin of the inside of the thighs, for instance, or on the upper arms. So we need additional treatments topically performed. It is not a slimming machine, but we can destroy fat areas with the deep hand pieces 6, 9, and 13 millimeters. Even though there are more and more plus size models, I can only say most people like to have a good silhouette. And when they have problem zones, they ask us, can you help us with problem zones? So do not tell them that they will lose any weight with this device. They are not going to lose any weight. If you can melt like the size of a piece of a jar of butter, that would be 250 grams of fat. But this is not influencing your weight. When you have 250 grams less weight, this is nothing. But when you have the size of a pack of butter less on your hips, that makes a big difference. So the discontent with the own body leads people to take stressful diets and hard training sessions in order to get rid of persistent body fat. And the blogs and magazines announce miracle cures to reach their aims, their goals very fast and easily. But the long-lasting results can only be achieved when the patient is being supported on his way and the nutrition plan is adjusted in process. So what we recommend is that you have somebody in the clinic who is giving good advice to the patients to stay on a proper long-lasting diet. The previous gold standard to remove extra fat is the liposuction, but I have to say, maybe I have bad luck, but I see, unfortunately, a lot of patients who are very sad about the results of their liposuction, even here in Switzerland. It's an invasive treatment. It's a painful treatment. It has downtime. It can cause bruises and swelling. And we are consulted a lot because of scars and a lot because of deformities, bumps, and dents after the treatment. And this is usually not right after the treatment. It is most of the time showing up after 1 to 2 years after the procedure. These early side effects like this, I don't know if you have seen this. Unfortunately, I have seen a lot of cases like this. Too superficial liposuction, and by this laser liposuction with severe damage of the dermis and a lot of scarring. This was how the patient was 2 weeks after the intervention. And situations like this, you can imagine these patients do not want to go for another liposuction because the liposuction made this uneven effects with this enormous side effects, side differences. So they ask us, isn't there anything that I can do only topically to remove these problem zones now? And this is a super indication for Ultraformer. Also, the inside of the arm. Here on the left-hand side, you see a case after arm lifting and liposuction with this unwanted dimpling. And on the right-hand side, for a long treatment with a shockwave and radiofrequency, we managed to even up some of the dimples. And now the patient can live with this situation. But this would have been a perfect indication for Ultraformer first-hand side. And this is what I'm talking about. This is cellulite after liposuction. The patient demonstrated me photos of before the liposuction with almost no cellulite, and then 2 years after liposuction, developing more and more cellulite. So the trend today is less liposuction and more non-invasive treatments, and it is also the combination of different treatments. They are safe, they have less side effects, they have no downtime, and volume reduction and skin tightening and optimization of the silhouette is possible. Regarding the options, what we have, so fat does not like heat. Heat is applied by HIFU. It is also applied by laser lipolysis. So we can use the Ultraformer body hand pieces. You can also use the Sizer by Classis or the sculpture. Then cold fat cells can be destroyed by cold. So cryolipolysis, that would be, for instance, the Cla2, what we also use a lot from the company Classis again. Radiofrequency, for instance, like Velo-Shape 3, shock waves, for instance, like AWT by Storz. Then there are mixed treatments. We have we give the patients food supplements. There's injection lipolysis, and this is also a minimal invasive treatment. In this table, you see the big variety of devices now on the market offering non-invasive body-forming treatments, and that shows you that there is a high demand on the side of the customer. Now, regarding legal situation, I can only speak for Switzerland, but in Switzerland, the treatments cannot be done by non-doctors. So the treatment Ultraformer, so HIFU, is exclusively for doctors' offices. And it can be delegated to instructed personnel in the clinic. But you have to be, as a doctor, you have to be in the clinic and you have to supervise your staff who is performing the treatment. And you should be very delicate to choose the right person to perform this treatment. And it should be a person who knows very well about anatomy. And so in my clinic, it is only me and 2 other doctors and 1 nurse who is performing Ultraformer, and the deep applicators are only performed by the doctors. You should not perform, or it's prohibited in Switzerland to perform treatment for instance, in rent premises in a doctor's practice. It is not allowed. You have to be the owner of the clinic, or you have to be announced at least. It has to be your clinic where you perform these treatments. It's not in that you cannot do this in an esthetician's place. So we perform a lot of courses here. So if you are interested and you are in Switzerland, you can. We would highly like to see you in one of the next classes of the Smart Aging Swiss Academy. You can see all these classes on the webpage of the Smart Aging Swiss Academy, and some of them are in English. And the internships, we have always a group in English. So, and then finally, I like to invite you for the SGML 21, what is the Congress in Switzerland, the one and only Laser and Procedure Congress in Zurich. And please save the date. It's the 21st of January 2021. So thank you very much for your attention. And I hope I could fascinate you, and maybe you are interested to start with Ultraformer treatments in your clinic too. But please be aware that you have to go for a training session to be really aware of how to handle the device with a practical training with either LaserMate company or even with the staff of Smart Aging Swiss Academy. Thank you very much for your attention.